Good afternoon, everyone, and I hope everyone is enjoying that beautiful Minnesota winter. My name is Jigme Ugen. I'm one of the executive vice presidents of SEIU Healthcare Minnesota in Iowa. In Minnesota, we represent over 40,000 healthcare workers. Our members work in hospitals, clinics, nursing homes, and provide home care services, keeping seniors and people with disabilities in their homes. Our union fights to strengthen the healthcare industry for workers and for the patients. But we also know that our members live whole lives outside of their work. That is why we are proud to be part of this coalition, fighting to ensure every Minnesotan, no matter our race, zip code, job, wealth, or gender, is able to live a safe, happy, and healthy life. A majority of our members are women, and many of them are immigrants and people of color. These members were called heroes during COVID, even when they were not provided with proper PPE during the early months, where they had to use plastic bags and constantly reuse their mask. We've heard stories of members who had to hold iPads and phones to FaceTime the final moments of some patients who couldn't be with their families. And this was happening while many of us had and still have the luxury of working from home. These members did not miss a single day of work directly facing the pandemic. They kept us safe and nursed Minnesota back to health. All this while risking their own lives and their families. Yet today, as we speak, they are still underpaid, and they still fight so hard to get safe staffing levels. Meanwhile, today, the wages of the CEOs and their executives, many of whom continue to work from home, have skyrocketed. Our heroes continue to struggle just to get by. As a union, we believe that how we take care of people caring for our loved ones shows how we value as a state. What we know is that for too long, we have been unwilling to demand that wealthy corporations pay their fair share so that we can ensure Minnesota is a leader in healthcare, education, housing, and many more. And because of the power of a small handful of Minnesotans at the top, our state has become a place where some fully thrive, while many struggle to make ends meet. The wealth disparity in our state remains shocking and heartbreaking. Minnesota would not run without home care workers, without nursing aides, without dietary staff, and without all those who keep our health system running. Yet they are so often so little paid that they have to work multiple jobs just to survive. This is wrong, and we all know that it is wrong. The DFL trifecta has a chance today to not only put a sort of a Band-Aid on this issue, not just use the surplus to address challenges that have been unaddressed for years, but to actually set the groundwork so that we can make sure this generation and the next generation and the generations after that have the best healthcare in the country, the best schools in the country, the safest communities in the country. We can make sure that we can continue to address climate change, put an end to the huge racial disparity in our state, and to lift all working families. But the current surplus will only go so far. And we won't be able to do what we need to do if we don't demand that wealthy corporations pay what they owe. Minnesotans with 3 houses should bear more responsibility than one person with 3 jobs. It's a simple common sense. So it's time to take action. It's time to make Minnesota's tax system more fair and ensure that wealthy corporations pay what we owe so that we have the collective resources to keep our families healthy, our schools funded, our communities safe, and to build a Minnesota that works for all of us and doesn't leave anyone behind. Thank you.